All right, here we are in episode 3 of our podcast, and today we are talking about Brazilian butt lifts, also known as
gluteal augmentation,
or BBL, which is a lot easier to say.
Yeah.
So basically, the BBLs, or fat grafting to the buttocks, has kind of evolved over time. Like initially, everyone wanted to have these big, massive booties, butts, kind of like Kim Kardashian, and I mean even she has kind of toned that down a little bit, and so is everybody else in their desires.
Yeah.
I think people just want to look, they want to change and some improvement in their shape, hourglass shape, but they don't want to go overboard and look crazy unnatural. Is that kind of the impression you're getting from patients that come in?
Yeah, I think so. They just want a more natural look these days. But like you said, Brazilian butt lifts didn't really become popular until like Kim Kardashian, I think, is when she had a buttock augmentation. Everybody was wondering how she did that.
And we have no proof. I mean,
we have no proof. She doesn't really come out.
Natural,
yeah, she doesn't really come out and say she had implants or fat graft.
But if she did, it was it was pretty dramatic.
Yeah. But celebrities just have such a big impact and influence, and I think it just kind of skyrocketed from there. Probably 2015, 2014, maybe.
Yeah. Maybe a little earlier than that, but it's definitely, you saw a trend where it was like super popular and then it's kind of tapered off a little bit. But more recently, I've just been seeing patients come in and it's more just reshaping, like instead of hip to waist ratio very straight, they still want the hourglass. And so, and that's where, to me, the term Lipo 360 has really taken off, which is basically exactly what we do with a BBL.
Right.
I mean, we really try to narrow the waist and then at the same time enhance the buttocks.
Yeah, I think the big, almost 50% of the operation is just the liposuction itself, just to enhance that, narrow that waist, maybe improve the inner thighs or the back of the thighs to give that better buttock shape and that transition of the the low back to the buttock. And then we use the fat just to kind of enhance those liposuction results. So BBLs are just not injecting fat into the butt and you're done. So it's more to it than that.
Yeah. Just kind of break it down. I think I kind of jumped into the whole what it's all about. But the actual procedure itself is taking fat from where you don't want it and put it where you want it, instead of just throwing it away like basic liposuction. So typically, liposuction, so make small incisions, abdomen, waist, thighs, take the fat out, and then we basically purify that fat and just make it just as pure as possible. And when we put it back into the buttocks or wherever we want it, the breast sometimes, then it grows in that new area. So when we put that fat in, I mean, we hope that as much as possible stays, but it doesn't always, right?
Right. Not 100% of the fat is incorporated that we inject. So, but usually I think typically probably around like 50, 60%. Sometimes you can get 70%, just because there's more area to put the fat. And so we want that fat to touch as much, as the surrounding fatty tissues where the blood supply is, so that fat does survive. So we don't completely have control of how much that fat does survive, but typically we can get a good majority of it, I would say.
Yeah. And usually after about a month or so, a lot of that's taken, and we can kind of gauge how good the results are. But the great thing is, though, like even if like only 30 or 40% of it takes, I mean, they already see a huge difference because we've narrowed that waist and we've enhanced the buttocks. And even if it's not that full 100% taking, I mean, it's still a good percentage takes. Yep. Who would you say, who's a really good candidate for this type of procedure?
So the patients that are a good candidate for this, first you want to make sure your weight is stable. If you're happy with your weight, then you want to maintain that weight, because once you do the Brazilian butt lift and get the fat injections, if you decide to lose weight afterwards, that fat will respond, the weight changes. So if you lose weight, the fat in the buttock can decrease, can make your overall volume less, but if you do gain weight, that fat can increase as well. So you want your weight to be stable. Also, you want to make sure that you have good skin quality in the areas that we're going to liposuction. So you want to have minimal stretch marks if possible. You want to have minimal skin sag or excess skin, so that when we liposuction those areas, that skin will shrink kind of like a balloon. If you fill a healthy balloon with water and then you remove some of that water, that balloon shrinks down and you don't have that saggy skin. So that would give you the best results.
Yeah, I would say that it's important because I have a lot of patients that come in and say, can I get a tummy tuck and get the BBL at the same time? Because they do have loose skin, and you can't really, it's not ideal time to do it, because when you recover from a tummy tuck, you gotta lay on your back. When you recover from a BBL, you gotta lay on your stomach. And so it's not good to combine those ideally. So, but if you need those, if you really want both of those done, we'll do the BBL first, let you heal, use all that fat that we from the future tummy tuck, and then go back and do that later.
Correct. I mean, even if you do stage the tummy tuck and the BBL, the advantage of that is not only is the recovery a little bit easier, but when you come back down the road 6 months later to do the tummy tuck, we can do some more revision lipo if we need to, if there's an area that just needs a little tweaking. So there are some advantages to staging it.
Yeah. You one thing I just want to touch on a little bit is that the procedure, it's a super popular procedure. A lot of people are driving down to Miami to, unfortunately, some places that don't have the best reputation and do it, and they'll do it for a lot cheaper. And I mean, it can be a little risky because this procedure, we're injecting fat, and that fat can sometimes get into the blood vessels or other things. As long as you are doing the technique properly and safely, that risk is extremely low. Correct. The problem is that it's almost like the Wild Wild West down there in Miami, in certain areas only, but you have to be just a little careful if you decide that you do want to travel down there and do it. I mean, if you need to save the money, just do your research and find somebody that has a really good reputation and is board certified.
No, I agree with that 100%.
One important thing about this procedure is the aftercare, and it's kind of awkward recovery because we don't want you to sit on that brand new fat that we just injected. I mean, if you want as much as possible to survive, you're gonna lay on your stomach, you're gonna lay on your sides, maybe some, but you're gonna stand a lot. So there are a lot of things you actually can buy to help minimize pressure on your buttocks, right?
Yeah, the simple brand is just the BBL pillow. I think if you just Google that, you'll type in BBL pillow and it comes up. But the idea of that with that pillow is you put on the chair or whatever surface you're going to sit on, and you end up sitting on the back of your thighs, and that raises your buttock off the chair. So you avoid putting pressure, so you don't get, you don't damage the fat, you don't displace the fat and get flattened areas. So like you said, standing a lot, that's the big thing. And then when you're sleeping, you're going to lay on your stomach for about 3 weeks.
Yeah, it's a lot easier for stomach sleepers with
exactly.
surgery, but it's doable. 2 weeks are the most important at the beginning.
Yeah.
Really try to maintain pressure off of the buttocks, and then second 2 weeks, a little less. But yeah, I mean, Amazon's your friend on this. If you can find these pillows, like I said, for the thighs. There's these big giant inner tubes almost that people will sit in, and they're kind of floating on the inside their living room where they're staying with. They're minimizing pressure, and I've kind of heard and seen it all. Like, there's nothing that's perfect for it, but there are some things that are made specifically for this. So, I mean, I think that kind of summarizes the main thing. I mean, it's really just trying to create that hourglass. And some people actually come in and already have, a decent shape. That's where they will just do that Lipo 360, where you just lipo all the way around the waist and just kind of snatch it in. And so that's, but some people, unfortunately, genetics-wise, just have more of a flatter buttocks or very straight hips and want more of that curve. And so this is where instead of throwing that fat away, just re-inject it.
Yeah. Great operation. Yeah. Great results.
Yeah. So anyway, that ends episode 3. What should we talk about next time?
Anybody want to send some ideas on Instagram?
Yeah. Anybody has any ideas, let us know, and we'll talk it up.